About what's happening at the Department of Veterans Affairs. On Wednesday, President Trump fired Secretary of Veterans Affairs, Dr. David Shulkin, said he'd replace him with his White House physician, Dr. Ronnie Jackson, a rear admiral in the Navy. Dr. Jackson has no experience running a large agency. This is the second largest in government, $200 billion agency. Dr. Shulkin says he was ousted because of his opposition to privatizing the VA, which runs 1,700 hospitals and clinics. So this is President Trump at a rally in Ohio on Thursday.
I had passed the VA Accountability Act, and now when they're bad to our vets or when they're not working for our vets, we say, hey, Jim, you're fired. Get out of here, Jim. Get out.
We can only imagine he's just getting Dr. David Shulkin's name wrong as he talks about Jim. But Dr. Eugene Gu, you've worked at the local VA in Nashville as a resident physician for the last 2.5 years. Your thoughts?
Yeah, I think a lot of this is a consequence of what it means to have elected a reality TV show guy who's not qualified to be president, who's now hiring all these people who are not qualified to be, the Secretary of Education like Betsy DeVos, or now the Secretary of the VA, Ronnie Jackson. Earlier he had even tried to appoint his personal pilot to be, head of the FAA. And Ronnie Jackson, who has absolutely no experience running a large federal agency, I think, earlier in your segment you talked about, you and Suzanne talked about how the VA is the second largest federal agency with a $200 billion budget. And Ronnie Jackson has no experience running that. As a resident who has worked at the VA, I know the benefits of having a single provider, nationally integrated system in which to care for all of our veterans. When we have a veteran coming from Miami to Nashville, I can pull up all of his records because there's a standardized medical record system called CPRS where we can take a look at all of the veterans' imaging, all of the veterans' medical records. We don't have to call another hospital and figure out what procedures he had done, and it's very, very convenient and effective for us. If the veteran, these veterans have very specific injuries. Oftentimes we can have a young 20-year-old veteran who has hearing loss that you wouldn't expect to see in a 20-year-old because of all the, loud gunshots that he's been having to hear. And, we can consult an audiologist. We can have an ENT physician see him. Having an integrated system is extremely important and cost-efficient for these veterans. Sometimes, I've seen there's been a hybrid push to see what privatization looks like by having a VA choice system. This choice system is where if a veteran can't get the care he needs at our VA within 30 days, he can be choiced out or sent to another private hospital within the community. Now, what I've seen with that choice system is that it actually degrades the level of care we have at our VA. For example, at the Nashville VA, the sterilizers were broken for quite some time. The sterilizers we used to autoclave and sterilize the surgical instruments. So the operating rooms were actually at very limited capacity because we didn't have clean surgical tools to operate on our veterans, which is a travesty. But because of this quote-unquote choice system, which allows us to send veterans to other hospitals, it was almost like a crutch that we used to say, okay, we don't have to really have that much of an impetus to fix these broken sterilizers that are not cleaning the surgical tools we need. We can just choice these veterans out to other local private hospitals, and they can still get their surgeries. Well, I had one patient come in the middle of the night, who needed emergency surgery, but because our sterilizers weren't working, we didn't have clean tools to operate on him. We had to, choice him out or send him, to another hospital, and that delayed his care. And I think that that's just one example of what can happen with privatization of the VA. Another example is we saw the horrible response to the disaster relief in Puerto Rico after Hurricane Maria when FEMA tried to privatize disaster relief. They gave a $156 million contract to a one-woman company. I believe his name was Tiffany Brown. And she was contracted to provide 30 million meals to these starving Puerto Ricans who just suffered this major disaster. And, it turned out that she only provided 50,000 meals out of the 30 million that she was contracted to provide. So they paid all this money to this lady who then just pocketed the money for herself. And
Dr.
I think
Gu, I wanted
yeah.
to ask you about another issue. You're one of 7 Twitter users who has filed a lawsuit against President Trump after being blocked from Trump's personal account. The case is titled Knight First Amendment Institute versus Trump. Very quickly, can you talk about what this is about?
Yeah, definitely. So one day I tweeted to Trump after he made a tweet about how he was doing so well in the Rasmussen poll. And I tweeted to him because recently he made, at that time, he made a comment about a typo called kafifi, which many people didn't know what that was. And so I wrote in response, Kafifi, the man who controls our country's nuclear codes, doesn't proofread his Twitter account. He blocked me for that. And I think that, you know, the President of the United States uses his personal Twitter account, you know, to make actual national policy announcements. And for instance, he fired Secretary of State Rex Tillerson through his Twitter account. He fired the Secretary of the VA, David Shulkin, through his Twitter account. This is a very important information for me as an American citizen to see. And so it's not necessarily his personal Twitter account anymore if he is using it in his capacity as a president of the United States to announce major policy changes and personnel changes.
Finally, we just have 30 seconds, Dr. Gu, but you tweeted a photo of yourself taking a knee and raising a fist with the caption, "I'm an Asian-American doctor, and today I take the knee to fight white supremacy." Dr. Gu, you were placed on paid administrative leave after the mother of one of your patients complained about that photo. Very quickly, your response.
Yeah, so I took the knee to fight white supremacy because when I was an intern general surgery resident at Vanderbilt, I was racially and physically attacked in the parking garage by a white supremacist. You know, he stalked me all the way up 9 flights of stairs at the hospital, grabbed me by my name badge, nearly choking me. And so when I saw the NFL players like Colin Kaepernick and Michael Bennett taking the knee to fight police brutality and white supremacy, it resonated very much with me. And so wearing the same hospital white coat and scrubs that I had worn the day that I was racially and physically attacked, I took the knee to fight against the very racism that I was the victim of. It was a very personal thing for me to be attacked like that, and so I wanted to do a peaceful protest to fight what happened to me, and I was punished for it.
I want to thank you so much for being with us, Dr. Eugene Gu, general surgery resident at